joined by CBS News medical contributor, Dr. Tara Narula.
Hi, Josh.
Hi. So Tara, first, the dissection, the vertebral dissection, exactly what it is. What is it, rather, that we're talking about?
So the arteries that supply blood to the brain, they can run in the neck, in the front, on the sides of the neck, and they can run in the back of the neck. And those arteries, when they develop a tear in the lining, that can either narrow the lumen, or the tube, so to speak, of the artery, which could cause decreased blood flow to the brain and cause an ischemic stroke, or a blood clot can form on top of that tear and either break off and go to the brain, or again occlude that lumen or hole, and all of that can lead to an ischemic type of a stroke, which is the most common type of stroke. Now, dissections are more common in younger patients, those less than 45. They tend to be anywhere between 8 to 25% of ischemic strokes. But again,
because they tend to be more active, because they're more exposed.
I don't think we necessarily know the reason why they tend to be more common in the younger population, but usually the older population has ischemic strokes that are either due to small vessel disease, microvascular disease in the brain, or embolic events from the heart, or from plaque in the aorta, or from plaque in the vessels of the brain.
And so extreme force is the factor here.
Well, it doesn't take extreme force.
And so I guess we're talking about a degree here.
I mean, that's a strong word.
Yeah.
And if you speak to neurologists, they will tell you that, these types of dissections can happen with minimal type movements of the neck. So we did a story last year that I told you about a young woman who was playing tennis, and just from playing tennis she ended up with a dissection. Things like golf, motor vehicle accidents, going to the hairdresser, these have all been case reports that have been associated with dissections.
So it's certainly possible that Katie could have just simply been more at risk than others, which is to say, it would be certainly a rush to indict chiropractic medicine, as opposed to seeing this perhaps as an individual patient.
Well, there are
who was at greater risk.
There are spontaneous causes of artery dissection that have nothing to do with trauma, and in those patients sometimes there is an underlying medical condition that predisposes them to it. There's something wrong with the connective tissues of the blood vessels at baseline, and they may be predisposed. But there are also traumatic causes, and interestingly, this is a topic that was explored in 2014 by the American Heart Association and American Stroke Association, who published a scientific statement about this very thing, manipulation by chiropractor, and whether that can result in cervical artery dissections, meaning the arteries of the neck. And in fact, they said that there is a small association. Now, they can't prove causation, but there has been data to suggest an association with chiropractic manipulation and dissections or strokes.
So if I'm a patient, bottom line, and I want to go to a chiropractor,
right,
what is it
well, the important
that
thing
I should be asking?
You should ask, first of all, the statement by the American Heart Association and Stroke Association said that chiropractors really should be informing patients about this potential risk. And that is, an onus that's on the chiropractor. But certainly stories like this, and any young person that has a stroke, should raise awareness in people that these things can happen. While very rare and unusual, it is possible. So certainly before you consider doing it, you want to think about it or speak to the chiropractor about it.
Certainly important. Dr. Tara Narula, Doc, as always, we appreciate it.
Thank you.